Hi everyone, it's Matthew here, Matthew McKenzie, carer, activist. And this is a short video, I'll try and make it short, on a new resource that's launched, as you can see here, developed by Carers UK and Carers Trust in collaboration with NHS England and VCSE Health and Wellbeing Alliance. And basically, the resource, as you can see here, is aimed at health and social care professionals. I will put the link. But there's a couple of links to download this resource in the description of this video. As you can see here, anyway, it helps professionals recognize, involve, and support unpaid carers effectively. So I'm just going to go through why this new resource just released, I believe on the 19th, actually, maybe earlier, released in February, early February. Let's put it to that. And it's called Identifying and Supporting Unpaid Carers in England to Improve Integrated System Working. I believe there's around about 40 or so pages in there, but it's very clear, and it's well designed in a PDF format. So, but what's it really all about? How can it make a big difference now? And how can it make a difference to health and social care professionals? Well, before we even go that far into working out how it can make such a difference, we need to understand why recognizing and supporting carers actually matter. So, as it stands, there's around about 4.7, perhaps even more, 6 million people in England that provide unpaid care. We can't forget also the 1.4 million caring over strenuous hours, over 50 hours a week, as I've put in the pictures there. These are an example of what unpaid carers may more likely be doing. Their contribution, though, can't be ignored. They are saving the economy. They're saving the NHS 152 billion a year. And despite their role, unfortunately, many carers do actually still struggle to access the support they need. And there is a lot of support out there. I'm not saying it's the best or it's the brilliant support, but there is a lot out there. But how do they know what is out there? And this is where this resource, this new document comes in. So care identification is the first thing that can actually help carers out, because as it stands, many carers, unfortunately, they don't really recognize their role. I mean, okay, they might be doing a role, but they don't recognize that they are unpaid carers. They don't need to be called or defined as unpaid carers. It's not really about that. It's trying to say, look, if you're doing that type of role, if you're caring for someone in that role and there's a lot of challenges, there is support. And this resource provides strategies for identifying carers early. So it's not just carers identifying themselves, it's actually the professionals as well to say, okay, look, this is a carer. What support can we give them? How can we identify them? And the very first step in regards to support is early identification ensures carers receive the help they need. Now, I've been involved in hospital discharge and unpaid carers. This is one thing I wanted to mention first because I do run this meeting. It might change in time. Um, but as you know, there are some people that fall into the carer's role when their loved ones discharge into their care. So we can't miss the important roles hospital staff can play when it comes to identifying carers. There is a new act, at least some years ago. Carers must be involved in hospital discharge planning as required by law. This is the Health and Social Care Act 2022. What we don't want is carers, unpaid carers, obviously, not to be involved in their loved ones' discharge or care planning and to fall into a role where they can't really cope. So this resource also includes a checklist and best practices for including carers in post-discharge care and ensuring care involvement improves recovery outcomes and reduces hospital readmissions because, as you know, it's not only the caring role that saves 152 billion, it's more likely that if the carer knows and has steps to provide unpaid care and can do that well, then patients wouldn't be going back into the hospital feeling unwell because the carer couldn't cope. Care shouldn't be alone, it shouldn't be hidden, and there is support from themselves. It shouldn't be just about what's there for the cared for. So there is social prescribing for carers. What does that mean? It means basically connecting carers with community-based support that improves the carer's own well-being. It's not easy, obviously, if you're caring for someone. You tend to focus on everything to do with the cared for, but there's a habit that carers can sometimes forget themselves. We don't want that. We want people, if they want to, continue their caring role. So social prescribing can reduce stress and prevent carer burnout. Healthcare professionals can and they should refer carers to mental well-being, mental health, and carer peer support services. This, in turn, can increase referrals back to carer centres. We also got care contingency planning. Now, emergencies, they can happen, and carers often need backup plans. Now, the guide that's been released in February helps professionals to assist carers in creating contingency plans with the carer, obviously. This ensures continuity of care when carers are unable to provide support. We can't forget respite. So this is carers' breaks and well-being. So unfortunately, many carers do actually struggle to take breaks, take respite, and this can lead to care burnout and mental health challenges. The resource also provides recommendations on respite care and flexible support options. And this allows supporting carers with well-being, which improves their ability to continue providing that much needed care. But it's important, as stated, carers do need that break. We're going back into the law and those responsible on following that up. So under the Care Act 2014, carers actually have rights to carers assessment and tailored support. So the resource, which I'll show in a bit, ensures professionals understand their legal obligations and or duties to unpaid carers. This includes local authorities and integrated care boards who monitor, I suppose, finance the care system, but they must ensure care-friendly policy so they don't forget how those changes in health services affect families, friends, and carers. So to sum this all up, we must admit carers do play a vital role in supporting health and social care systems. As I mentioned, 152 billion. But what really matters is by recognizing, involving, and supporting carers, we actually improve outcomes for carers and those that they care for. You can access the full resource via the Carers Trust and also Carers UK website. And as you can see, there are links that I'll also put in the video description. So do have a look below when you can. Looking onto those links, you'll actually see those resources. One of them I've just shown being Carers Trust. And the other one, which I'm also showing in a bit, will be Carers UK. And when clicking on those links, you'll actually see what that resource looks like. Do download that. Also, feel free to share it with others, especially health professionals, not just hospitals. You've got your GP surgeries as well. And I feel use that resource to hold, your integrated care boards to account, your local authority to account, especially those who lead on care strategy. I've only just summed up a really small part of the resource, the document that you can download. It's used to educate others and gently remind them that carers are there and that they need that support. So I'd like to say again, thanks for watching. I hope this video has been useful. Do share that and we can make a difference for carers across England. Thanks for watching and take care of yourself.